We'll finish up our look at fluid balance by taking a look at solute concentrations and how they vary within the blood and the body, as well as a little acid-base balance as well. So when it comes to the body, one of the big things that we've talked about so far with the kidneys and water balance has been salt. And so sodium chloride primarily is one of the salts that we're going to talk about. And so in terms of daily salt intake, we're going to get, depending upon, and this all depends upon the foods that you're eating, but as much as 10 grams of salt in a day is kind of the minimum that we need to get. And so if we're not getting salt in from our diet, this is where we can start to have issues with balance in the body as well. Most people generally are going to tend to have way more than 10 grams. Salt is kind of hidden in many products here and there. You look at essentially all products and you're going to see a sodium listing for how much is in there, and usually it's going to be in the milligrams range for what it happens to be. Especially packaged foods tend to have a very high sodium content. And then there's the sodium that we add to our foods if we're cooking, things like that. And again, if it's kind of a packaged food on top of, or a packaged food, and then as we're preparing it, we then add even more salt, we can definitely end up having way more than this 10.5 grams in a given day. So, but that 10.5 grams is something that we're able to control through our urine. And so some salt is generally going to be lost throughout the day simply through sweat, through our loss of fluids throughout the day itself, and through fecal matter. So sweat, tears, anywhere that we're losing water through the body itself, that's where we're going to potentially lose some of that salt. And it's not a lot. The majority of it is going to be controlled by the kidneys in urine output. And so in general, again, we're going to have the same input as output. If this ingestion side goes way up, typically as long as the kidneys are functioning properly, then we're going to be able to handle any kind of increase that has come in from ingestion. If not, again, our fluid balance is going to start to become disrupted. And so if we have that increase in sodium coming in through the diet, say, and so we now have an increase in sodium that's being absorbed by the digestive tract, that gets an increased amount out into the blood. So we end up with a hypertonic solution when it comes to that sodium inside the plasma. So how do we get rid of it? How do we balance that out then? Well, we balance that out by taking in more water throughout the day. And so we're going to reabsorb water by the kidneys. So we're going to increase the amount of water that's coming into the body. We're going to have a thirst component, which is then going to add more fluid into the body. And so we're going to have an ingestion side change. So the kidneys are going to decrease water loss. The digestive tract is going to increase the amount of water absorption because we're ingesting more throughout the day itself. And then we're also going to get a movement of intracellular fluid moving into extracellular fluid. And so essentially our cells are going to start to dry out a little bit. And if all that works, then our sodium levels are going to return back to normal, and we're now going to have a fluid volume increase. So what happens if our fluid volume has increased? This potentially leads to things like higher blood pressure. And so this is one of the reasons why if somebody has higher blood pressure already, they may be told that they should go on a low sodium diet. And so they should decrease the amount of sodium that they have coming into the body, thereby to potentially decrease the amount of fluid that they're retaining as well. From there, we have the concentration of sodium decreasing. So if for some reason we're not getting enough sodium in our diet, we've changed our diet, something like that, and now our sodium levels have decreased, that means that we're going to end up with a hypotonic type of a solution inside the plasma, which is then going to force water towards the more hypertonic intracellular fluid. So we're going to get that movement from the extracellular to the intracellular space as far as the water movement is concerned. The kidneys are going to say, okay, we've got essentially less sodium. We don't want to dilute the amount of sodium that we have anymore. And so we're going to get less water reabsorbed by the kidney. And so our water levels are going to go down. We're going to suppress thirst. So we're not going to think that we're thirsty. We're not going to necessarily be desiring to go drink anything on there. And that's then going to bring, once again, sodium levels back to normal. So our fluid volume has decreased, and this potentially leads to a decrease in blood pressure. So decreased volume equals decreased blood pressure, and an increase in volume equals an increase in blood pressure as well. So the two are going to be balanced with one another. And again, this is similar to the point in terms of treating things like high blood pressure. Sometimes this is done with a so-called water pill. This is done with a diuretic. We talked a little bit about diuretics in terms of the kidneys as well. And that's going to alter our reabsorption of water, make it so that we reabsorb less, and our body is then going to have that decreased volume. So when we looked at cells before, we talked a bit about tonicity in terms of the cells based upon the amount of fluid concentration that's there. And so did we have something that was isotonic, hypertonic, or hypotonic, and what that would end up doing to the cells themselves. And so this can change that and alter that. We just saw that in the last slide where we get a movement of fluid going from the extracellular space to, or the extracellular fluid to the interstitial fluid and vice versa. And this either causes the cells to then shrink or to swell in the areas. This can also lead to the interstitial fluid. So the cells are only going to absorb so much. This can lead to the interstitial fluid gaining volume as well, and we get edema into the cells that are there. Changes in membrane potential. So we looked at before in terms of the nervous system and muscle. And when muscle needs to contract, we need to have membrane potentials. And so if sodium levels are not being maintained, we're not necessarily going to have that high concentration of sodium on the outside of a cell in order to cause depolarization. And so our neurons, our cardiac muscle, smooth muscle, skeletal muscle may not function properly. This can happen simply by changing any of the ions that we have or the electrolytes that we have in the body and disrupting that potential ability to fire off action potentials as well. Acid-base balance we'll talk about in a sense kind of all by itself here in just a little bit, but then this can also change by diluting the extracellular fluid as well and making a change to make things either more acidic or more basic within the body itself also. So those electrolytes. And so we've talked about sodium quite a bit, talked about it in terms of the sodium-potassium pump. We talked about it in nervous system, in skeletal system, in the muscles, etc. So lots of different places within the body where we've talked about sodium. This is typically more abundant in the extracellular fluid. So this is where it becomes important for things like action potentials. And so we have changes within action potentials potentially, and the ability to alter those. We saw them already in terms of blood volume. And so kind of wherever, if in a sense, sodium is going this way, water is going to follow it, and so on. And so we're going to move the water towards wherever that sodium happens to be, and so that's going to change volume. And then in the end, if as water goes either up or down, blood pressure is going to follow as well, and so we'll have an increase or a decrease in blood pressure also. And so that makes an alteration there as well. Next up, we have potassium. Potassium is more prevalent in the interstitial fluid, or I'm sorry, in intracellular fluid. And so in a sense, this should make sense because we have our sodium potassium pump. And so if sodium is pumping that sodium out into the extracellular fluid, then potassium is coming into the intracellular fluid as well. And so it's going to move in opposite directions from one another. And again, important in maintaining that membrane potential. It's not necessarily the trigger, so to speak, for the action potentials, but if potassium levels become altered too greatly, they can certainly start to alter things like muscle contraction. On those. And so definitely something that needs to be monitored as well. Chloride ions. Chloride ions are out there in the extracellular fluid once again. And although in terms of chloride ions, we typically think of them as salt in terms of sodium chloride, but they then dissociate into their components within the solutions themselves. And so this is once again going to potentially cause problems with neurons. And so the ability to allow them to contract and change their excitability within the body itself. And as chloride ions move in one direction or another, they can also change other ions as well and alter their movement in and out of cells also. Calcium, important. We've talked about them in terms of the bones quite a bit as far as the body itself goes. And so we have tons and tons and tons of calcium stored inside the bones, a little bit stored inside the teeth as well. So this is not in the actual cells, but this is in extracellular fluid that is there. And once again, important in the production of our action potentials, especially at the end of the action potential for the nerves and for in the muscles. This is going to be for the production of our actual contraction. And so this gets us to the contraction of muscle itself and releasing that binding site for myosin. Phosphate, another important one, again, typically stored inside the bone. And so calcium phosphate, our storage form for calcium, combines phosphate and our calcium together to give us that storage form or that storage ability for calcium itself. But also important in terms of ATP, adenosine triphosphate. And so we've got 3 phosphate groups on there. And we're going to need to have this there in the ability to make more ATP, get energy production done. It's also a good buffer within the body as well. Magnesium, this one is again primarily found in bone. And so we have it found within the bone cells themselves. And so this is going to be in those cells themselves, similar to that of phosphate. This one's going to be more so in relationship to doing things like our chemical reactions. And so this is going to be a facilitator for enzymes and their ability to function, as well as the ability of muscles to stay relaxed. And so when magnesium levels start to fall, our muscles tend to be more kind of tense and tight rather than in a relaxed state. So the ions themselves are quite important for that maintenance of our overall balance of water within the body itself. So way back when as well, we talked a little bit about the blood, and with the blood, we started to talk about pH. And so with blood pH, we had said before that blood pH is right around 7.4, but gave a range from 7.35 to 7.45. And so this was kind of our normal range there. And that's because we have a difference in the pH between arterial blood and venous blood. How can that be? So how could we potentially have a change in pH constant or a pH of blood just because we're either in the arterial side or the venous side if the blood itself is in a continuous loop? And so we have to think about the content of arterial blood versus venous blood. And in terms of venous blood, we have an awful lot more CO2. And back when we talked about blood as well, we said that CO2 then gets converted over into carbonic acid. And so if we have carbonic acid in the blood, that's going to increase the amount of acid that is there and thereby lead us to having a lower pH. And so this pH that's there is not causing us any kind of problems as long as the pH does not go below 7.35 or above 7.45. And so if we stay within those ranges, all is good. But if we go above or below them, then we're going to have either an acidosis or an alkalosis. And from there, we need to find the cause. And the workable range for blood as far as our pH goes is roughly 6.8 to 8.0. Anything above that is potentially going to lead to death. And so if we keep it above or below that range for more than just a few seconds and we're not able to buffer things, then we're generally going to have death within moments. So hydrogen ions are where we're getting the ability to have acidity within the body itself or in anything. So the hydrogen ions are in a constant state of flux. We just mentioned in terms of carbon dioxide levels, we have carbonic acid forming when we have carbon dioxide in the plasma. And so as we have that there, we have a fair amount of CO2. So just hold our breath for a little bit. And as we hold our breath, our CO2 levels go up. Our carbonic acid levels go up. We start to become more acidic within the body itself. Other processes can be from using our body. And so if we're doing things in an anaerobic state, and so if we're trying to do exercise, things like that, and our muscles are becoming overworked, and we're creating this excess of byproduct from normal metabolism by doing it in an anaerobic state, that's going to lead us to have that acidity increasing as well. If we're in a state of ketoacidosis, and so if we're decreasing our glucose intake and increasing our use of fats as energy, that's going to lead to keto acids in the bloodstream as well. And those ketones are then going to have to be eliminated from the blood in order to get our pH to go back up. Same thing if we're breaking down whole cells. We're going to have the breakdown of nucleic acids from the nuclei themselves, and this is going to lead us to having an increase in phosphoric acid. That's going to occur there also. And once again, our pH is going to then be lowered. The respiratory system can be a source of changes within our acidity within the body itself or our alkalinity as well. We talked about this a little bit when we talked about our respiratory system and we did breath holding and exercise and hyperventilation before. And so we kind of saw the changes that occurs with CO2 and O2 within the body and how simply changing our ability to eliminate, especially CO2, can very quickly start to change our body's pH levels. And so with respiratory acidosis, this is where we have an abnormal increase in carbon dioxide within the body itself. And so we're retaining carbon dioxide. This can be from disease. And so we have reduced gas exchange. This can be things like COPD, where we're retaining our oxygen levels that are there. Certain drugs can cause a depression of the respiratory center. So this can lead us once again to hypoventilate, and that then decreases our respiratory drive for things. This is everything from medication, normal kind of prescription medications, to things like our recreational types of drugs as well that are there, street drugs. Nerves and muscle disorders can potentially cause this. We talked about back when we did the muscular system, we talked about things like ALS, multiple sclerosis, all have the potential ability to change our respiratory abilities that are there. And again, we're going to get CO2 building up. Alkalosis generally is from hyperventilation. So we're blowing off too much CO2. And this could be from having things like an anxiety attack. So a person is just simply hyperventilating as they're going along. This can be things from when we are sick and ill, from fever as well. And an overdose can come from aspirin poisoning. So we're going to have not from hyperventilation, but excess amounts of aspirin then leads to a respiratory alkalosis. Things can happen inside the body as well, and we can have a metabolic acidosis or alkalosis. And so with that, we can have things like diarrhea. And so if somebody is losing lots of water through their digestive tract via diarrhea, this is going to essentially kind of drag with it bicarbonate. And so this is, if we take away bicarbonate, our body's ability to buffer pH goes down. And so the hydrogen ions are going to start to accumulate more as well. If a person has diabetes and they are breaking down fats in response to that, so they're unable to use the sugars that they are getting from their diet, but they are producing sugars via fat metabolism, the same process comes in terms of the ketone buildup as well. And so this can lead to that same process there. Excess exercise or very strenuous exercise can lead to a large amount of lactic acid buildup within the body itself. Quickly, it's going to dissipate away from the muscle cells, but then the blood has to deal with it from there. If the body is unable to properly clear hydrogen ions from the kidneys, because the kidneys are in failure, once again, a metabolic type of acidosis is going to ensue. And then we have alkalosis. This is going to be where we're losing now the hydrogen ions. And so whereas diarrhea causes us a metabolic acidosis, vomiting can cause us a metabolic alkalosis. And so we're losing the hydrogen ions from the stomach, and we're unable to replace them fast enough. When somebody does have too much hydrogen ions or hydrochloric acid in their stomach itself, this can lead to things like heartburn. And heartburn has with it the pain and the discomfort and things like that. And so one kind of over-the-counter remedy that people have used in the past was to utilize baking soda. And so baking soda is typically going to have a bicarbonate in it as well, and that's going to allow the body allow the stomach acid to become neutralized inside the stomach. The downside to baking soda is that it is also absorbed through the stomach lining. And so that is not going to be good, because not only is it's good for the stomach, but then it's going to get into the bloodstream and cause an alkalosis there as well. Versus things like our Tums types of medications, those aren't readily absorbable through the digestive tract. And so those are going to stay in the digestive tract and not cause that alkalosis there. Whether we have a metabolic acidosis, a respiratory acidosis, or a metabolic alkalosis or respiratory alkalosis will then dictate kind of how our body starts to compensate for these issues that are there. And so some of the ways that we can do this is by going and utilizing what we already have by using things like chemical buffers. And so this can affect things in just seconds. That is going to be things like bicarbonate that we have in the blood, and it's going to essentially kind of suck up or soak up excess amounts of hydrogen ions. And so we can utilize those and move those away. And then we don't get into any kind of acidotic state at that particular time. We can have a respiratory compensation by either increasing hyperventilating or decreasing hypoventilating the CO2 levels. So if we have a metabolic acidosis, we can look to the respiratory system and we're going to compensate with a respiratory hyperventilation. So if we've got excess amounts, we're going to hyperventilate. So we'll hyperventilate and we're going to have a respiratory compensation. The same thing goes if we have too much, if we have a respiratory acidosis. So we've been blowing off too much, or keeping the CO2. So we have a too much CO2 in, we haven't been blowing it off enough. We're then going to go to the kidneys, and the kidneys can then start to do a compensation as well. And so with a respiratory type of a problem, we go to a urinary compensation or a renal compensation for that. And vice versa. If there's a metabolic problem, we're going to potentially then do a respiratory type of thing. So if somebody's having a metabolic acidosis in the body, we're going to typically see a hyperventilation as well. When we have these imbalances in pH, one of the big things that oftentimes is a problem is enzyme activity. And so we saw this a little bit with the digestive system, that certain enzymes require a pH level that gives them an optimum function. And if we stray from that level, we don't get the amount of activity out of that particular enzyme as is needed at that point. And so this is where things like pepsin in the stomach works at a very low pH, but then trypsin over in the small intestines works at a relatively higher pH. All doing the same thing, but doing it in different areas of the digestive tract. Big thing that can happen as well is nervous system and muscles. And so if we're changing the pH within the body itself, this doesn't allow our nerves and our muscles to fire off the way that they normally should, and we're going to have the potential for death there as well. Potassium levels become affected by hydrogen ions as well. And so when we have a change where we have excessive hydrogen ions, so we have increased levels that are there, they get secreted by the kidneys. And when that occurs, in a sense, it's a trade-off to where we retain the potassium. And so potassium levels are going to start to grow up with that as well. And so that can lead to those changes. So in the end, we need to be able to balance out our pH levels. We need to be able to balance out our volume levels. And within all of that, we have our electrolytes and our osmolarity of our concentration levels in order to be able to keep everything well tuned, well hydrated, and not having an excess or a decrease. And we'll go from there.